my name is Chedid. I'm a hematologist and medical oncologist. I practice with Singing River Cancer Center down in the Gulf Coast. And as you guys know, MDS is an exploding field. There's certainly some huge changes that are going on in there. Obviously, luspatercept, with the command study showed that, it shows a superiority to epoetin for transfusion independence in the frontline setting. It certainly works substantially longer than erythropoietin agents. It's given every 3 weeks. It has a faster response, and it causes a mean rise in hemoglobin to be substantially higher than erythropoietin agents in the frontline setting. Now, as you guys know, or most recently, we now have second-line studies with imetelstat, which is a telomerase inhibitor, and it inhibits apoptosis, so it works in a very different way. And the IMerge study showed that it had increasing transfusion independence in about 13% of patients. And for those patients, their transfusion independence was pretty significant. Now, the indication is for patients who've received 4 units of blood within an 8-week period. And for the 13% of patients who responded, they had a pretty substantial transfusion independence time. So that was pretty impressive. There was some significant myelosuppression, but for the patients who responded, great response for a protracted period of time. Other second-line agents that are present, we have decitabine with cedirzine with the Incovi, which is used for in low-risk MDS. It can be used also in MDS. The problem with it, though, is that it causes some some worsening of transfusion dependence in the short run, with some significant myelosuppression, unfortunately. But there have been some transfusion independent responses that have been quite prolonged as well.